I'm Erin Flanagan. I'm a pediatric palliative care physician, and I had the honor of caring for Lauren Graver. There was the initial clinical aspect of her care that needed immediate attention, and that was getting her pain under control. And that was, in my mind, always the first and foremost goal before you can really embark on learning what that child is all about, what that family is all about. Nothing that you see is real until a child's out of pain or their symptoms are controlled.
I remember thinking that the diagnosis was so devastating, but then I felt that no one was listening. Like you could see her writhing in pain on her hospital couch. And I asked for pain meds. I asked her nurses. I asked the residents. I asked the oncology team. And no one would give her anything stronger than Tylenol.
I think pain is so subjective and so hard. There is so many different aspects about pain that we don't do a good job assessing and reassessing, and then how they respond to our treatment. I think something that parents can do is ask a question, which is, can you help me understand why you're not giving my child more pain medicine? It seems that you're afraid to give my child more pain medication because it could harm my child. And I'm not seeing that. Can you help me understand?
So then as we were trying to treat all these different issues, she would go to different providers. And I remember one specifically when Faith was talking about the pain she had at night and needing assistance in sleeping because she wasn't sleeping. And he truly just diminished her and said, well, you're probably just spending too much time on your phone. Here's a book to read. And a book to read around sleep cleansing and how to prepare for bed and all this. Meanwhile, she's writhing in pain at night.
I've heard stories like this before where people in my role have questioned and doubted and said stuff like, well, you shouldn't be in this much pain, with the sort of unspoken end of the sentence being, thus you are not, as opposed to, I just don't understand. And because it's a hard thing for physicians to say. And I think that's one thing that we do in palliative care. We recognize that pain is what a patient says it is in the way they say it is.
Somebody said you're going to see a palliative doctor. I really did not know what that meant. And Erin walked in, and we had been cautioned about pain meds because they were afraid Lauren would get, opioid addiction. And Erin said, we're going to take care of it. I think within hours, for sure within 24 hours, I had my daughter back.